Hi, this is Helen, and this is my video assignment for Introduction to Psychology. First, let's define what is normal and abnormal behavior. The abnormal behavior is when a person does something that causes them a great deal of discomfort and stress, so much so that it is hard for them to deal with something on day-to-day basis. It is hard for them to focus on their life and on their chores. In this video, I will be talking about 3 specific disorders: binge eating disorder, generalized anxiety disorder, and PTSD. Let's talk about binge eating disorder. Binge eating disorder is different from anorexia or bulimia. For example, in bulimia, when they binge, they purge after, but binge eating disorder usually doesn't have the purging part. They only binge. A binge can be a result of a stressful day, a depressive mood, or a low self-esteem. The binge usually continues due to the lack of self-control. We as people are rewarded with food all the time in our childhood and in our adult life. When we were kids, I'm sure that when we would get a good grade, we would be rewarded with ice cream or something sweet. The same follows us in adulthood life. But the difference between a binge eater and a typical person is that a typical person can eat a pint of ice cream on a bad day, but a binge eater would follow this pint of ice cream with a bag of Cheez-Its, and a lot of the times with second bag of Cheez-Its. The typical binge consists of anywhere in between 5,000 calories to 15,000 calories. In comparison, these two bags are 13,000 calories. Every time after the binge, the person who suffers with binge eating disorder, there is no purge. But there is a lot of stomach discomfort and sometimes even vomiting because of such a huge volume of food. This disorder is treated with therapy, and a lot of the times the therapist uses the method where he tries to break the link of pleasure and food. For example, he would try and talk with his client that in order to break this link, he would need to replace food with something else to battle this stress. For example, go for a walk after a stressful day. The second psychological disorder we're going to talk about is a generalized anxiety disorder. This is a disorder where excessive anxiety and worry has been following a patient for a prolonged period of time, usually 6 months or more. People with generalized anxiety disorder usually worry about such things as school, finances, work, kids, and many other things. In a nutshell, these people are called general worriers because they worry about a lot of things. For the purposes of this video and the demonstration of it, we will be talking to a person who suffers with this disorder and see how they cope with it on a day-to-day basis. What does your day-to-day life look like with the generalized anxiety disorder?
My day-to-day life usually starts off with worry. I worry when I wake up about what's going to be going on throughout the day. Am I going to make it to work on time? How bad is my commute going to be? Am I going to be getting sick at work? All sorts of things that happen throughout my day could possibly set off even a really bad panic attack.
How often do you experience anxiety or panic attacks?
At least 2 to 3 times a day, and the causes usually vary.
What usually triggers them?
Most of the time it's completely random. That's one of the problems with generalized anxiety disorder is you never know what's really going to trigger it. It could be the most mundane thing. It could be just the general course of the day. You know, your boss, you could be having a bad attitude and you're wondering, is it you that did it? Am I going to get fired? It could even be the weather. You know, am I going to be on my commute home and is it going to rain? Anything could trigger it, really.
What do they feel like? What are the physical symptoms of them?
Well, the physical symptoms usually depend on the intensity of the attack and most of the time even what triggers it. A mild panic attack could be just a little bit of shortness of breath and a rapid heartbeat, which isn't really too bad. Then as it gets more intense, it could be shortness of breath to the point where you almost feel like you're going to pass out from hyperventilating. You could feel like that your heart is going to literally jump out of your chest or explode, which really doesn't even help very much either, because then you're worried, am I going to pass out, or am I going to have a heart attack? Sometimes my hearing will get muffled as if someone's holding their hands over my ears because my heart is beating so much, it's increasing the pressure in my head, and there's been a point where my vision would narrow, and it's pure hell. The worse they are, the more the physical symptoms are manifested. And there's been times where I've had such bad panic attacks, I have passed out. There was even a panic attack where I thought I was having a heart attack. My hands went numb and blue, and I felt like I was losing oxygen, and I felt like I was dying. And I actually ended up in the emergency room for that one. And that's actually how I was diagnosed, is because I thought I was having a heart attack, but they told me it was just a severe panic attack. And that's when I was diagnosed with anxiety. It's really hard to deal with the symptoms when they come on, but when they're there, they're usually pretty intense.
How do you cope with this disorder?
After seeing a psychiatrist, I was prescribed medication to help manage my generalized anxiety disorder. But most of the time when I have a panic attack, I usually focus on my breathing. I use grounding techniques, distraction techniques. The medication does help them not get really bad and out of proportion, but they still get them. And most of the time, managing my breathing and distracting myself from feeling like I'm going to die usually helps me cope with them. Those grounding techniques will also help me distract myself from what's causing the panic attack. So a combination of medication, breathing exercises, and grounding yourself into the real world is just some ways I'm able to cope with generalized anxiety disorder.
Last but not least, we're going to talk about a third psychological disorder, which is PTSD. It stands for a post-traumatic stress disorder. PTSD occurs when a person has lived through something very stressful and very traumatic. For example, nowadays we can see what's going on in Hong Kong, and most likely a lot of those people will be suffering with PTSD. A lot of people with PTSD have triggers. For example, referring to Hong Kong people, they most likely will have triggers like vibrations or loud noises because of military trucks and police. PTSD can develop not only from such extreme cases as when a person lives through a government uprising or goes through a war zone. It can also develop after living in a domestic abuse relationship or having a childhood where there was a lot of abuse and addiction going on in the family. A lot of PTSD victims suffer with anxiety and panic attacks. Usually they happen after presenting with a trigger. Like with the Hong Kong example, those triggers would be like a big truck going by or a train that would cause vibration. And after this trigger, a person's body would enter into a fight or flight response. This response feels like you have a heart attack, and your chest gets tight, your limbs go numb, they feel cold, your stomach area feels warm, you get a shallow breathing, your vision goes into what is called a tunnel vision. It feels like you are having heart attack a lot of the times. It is treatable with therapy and medication, usually a combination of both, with medications such as antidepressants and anti-anxiety. And to finish this video up, I want to include a video of people who do suffer from PTSD and what it is like for them to live with it.
I have PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
I live with PTSD from Iraq every day. Nobody knows, they just think I'm antisocial, boring, and a bit strange.
I can't keep a relationship going because of my PTSD. There's gotta be a girl out there who's willing to look past it for me.
I have PTSD, and when people find out, they ask where I served. When I tell them I wasn't in the military, they dismiss it like I'm lying.
I have severe PTSD, but I'm afraid to get the diagnosis. I don't want a label, a handout, or sympathy. I just want help.
I secretly live with post-traumatic stress disorder. I try to act carefree, but I live on alert.
I hate it when my PTSD acts up, and I'm suddenly afraid of everyone.
My trust issues make everything so hard, and I wish I could just forget my past. But my PTSD makes it impossible.
My ex left me because I have PTSD and wouldn't open up about my deployment.
My PTSD makes me feel alone and unwanted, which makes me angry at people.
PTSD has made me a prisoner in my own mind.
I thought my PTSD was getting better, but then the flashbacks started up again. I'm exhausted.
I have PTSD. My service dog saved my life. He gives me unconditional love and a reason to live.